Thank you so much for joining us for another segment of Lawmakers Live this Friday. I'm Ava Montoya, and today we're so happy to be joined by Representative Heather Carter. So to start off, just tell us a little bit about your district, who you cover, what's going on down there.
Well, very good. So I represent North Phoenix, which is pretty much everything north of the 101. It goes from Scottsdale Road to 67th Avenue, jogs down on the east side in what's called as the magic zip code, 85254, and over on the west side, just north of ASU West, and then all the way up approximately to Lone Mountain and Carefree Highway. It's a great district, incredible constituents. It's a booming economy up there. We have some very large employers. We have some fabulous hospital systems, 3 great unified school districts, a number of charter schools. I'm honored to represent the citizens of LD15.
Great, and we know they love you. So yesterday, the governor rolled out a proposal to boost teacher pay by 20% by 2020. What is your initial reaction to that?
Well, this is a great day for education, for teachers, for students, for our school systems, because this is a bold plan forward to get the additional dollars and resources we need to schools at a time when it is critically needed. So there was a lot of opportunity for us to celebrate yesterday. Now it's time for us to roll up our sleeves and get the work done.
Great. Well, we're excited to see that happen. It would obviously have to find its way into legislation that would pass both the House and the Senate. How do we get there?
So the budget process is somewhat complicated, especially when you're looking from the outside in. There's a series of bills that are introduced. There is one bill that has all of the money attached to it. Then there are follow-up bills that have the policy that instruct us how to expend the money. So there's a series of bills that will be introduced. Right now, we're working on the conceptual design of what will go into those bills. So the governor, in his address on Thursday, said that the leadership of both the legislature and the executive office will be looking at numbers and policies that they'll be packaging together then to introduce bills. It is my expectation that next week will be a very long week, perhaps some all-nighters, where we will have an opportunity to review the policies that will be introduced into the bills. Then those bills will be put on the website for the public to read and review. And then we will begin the traditional budget process where we will go into appropriation meetings, and members of the public will have the opportunity to come down and testify on each one of the components of the budget package. So that takes some time, and I think we'll see that hopefully happen next week.
Great. And what's the outlook for that? Do you think it'll be successful, just for getting it through both chambers?
Well, the good news is we have to have a budget. We're not like the federal government. We can't just keep kicking the can down the line. So at some point before the end of the fiscal year, which is the end of June, we will have a budget. But everybody's fingers are crossed that this will happen next week. There's a lot of work that will need to go in place over the weekend and then into next week. The public will see probably lull in action on floor work, meaning voting on other pieces of legislation. There are no other committee meetings that will be occurring at this time. So once those bills get introduced, that's when the budget will start to be introduced into the legislative process, and you will have the appropriation committee meetings. And those typically can take 6 to 8 hours or even longer just to go through each one of the bills on both the House side and the Senate side, because the bills have to be successful in their exact same form, both in the House and the Senate, and then would be sent to the governor.
Well, we appreciate the all-nighters, certainly.
Yes.
On a similar note, school safety has also been in the conversation. Can you just give us a sense on how the conversations are progressing on that front?
So last week, there was a bill introduced on the Senate side. It's Senate Bill 1519, and that is the initial start for the negotiations on the school safety package. So now we will have the legislative process take place in the Senate, so we'll receive a hearing, people will be able to testify, it will move to the floor, and we're waiting to see on the House side, there is no plan yet whether we will introduce our own legislation or if we will wait to receive the Senate bill. So the conversation will start in the Senate. So people who are interested in testifying on the school safety bill should focus their efforts right now on that Senate Bill 1519, and then we will figure out on the House side, do we introduce a mirror bill, do we introduce a different bill, or do we hear the Senate bill? All of that is still up for discussion. So legislative members right now are reviewing that language, and it's a great step forward. This is a bold plan, and whatever package moves forward, we are working relentlessly to make sure that our kids are safe in schools, and that's what we need to stay focused on.
Right, you're absolutely right. And so finally, we've talked a lot about education pretty
Yes.
much all day, but what are some other bills that are, priorities that people in Arizona should be hearing about and maybe you're getting lost in the shuffle?
So I serve as the House Health Chairwoman, and I always like to bring up bills that maybe don't necessarily make the front page of the newspaper, but are critically important. So for example, we have a community health worker bill that is queued up and waiting for a vote in the Senate, and I am hopeful that will be done. I'm not sure if it'll be done before the budget or after the budget. I'm obviously advocating for sooner rather than later, but this is a bill that is designed to advance a workforce in the healthcare system that is not only going to help bring about additional gains in quality outcomes for the delivery of healthcare, meaning improved patient outcomes, but also as a way for us to save money at the state level from a systems perspective. These community health workers are critical partners in delivering healthcare, in helping our patients and constituents navigate some things that happen outside of the healthcare delivery system that impact their health outcomes, like housing, food needs. These are called social determinants of health. So it will help our patients, our constituents, navigate all of the other stuff around making sure they're taking their medication on time, making sure that they're following up on their appointments. Now we want to put these professionals in place and recognize them from a state perspective through a voluntary certification program to allow them to say, yes, we are part of the healthcare delivery system, and we are recognized through a voluntary certification program at the state.
Great. Well, we appreciate your work, education, budget, community health. So thank you so much for joining us.
My pleasure.
Thanks for sticking around, and good luck with the rest of the session.
Thank you.
Thank you.